In the little community of Dexter, Oregon, a devoted group of patients love coming to their clinic and seeing one person in particular.
Hi, I'm here. Okay, thank you.
There are a lot of community clinics, and they offer a broad range of services, you know, dental, or a place where people can come and take showers. And we don't have that kind of capability here, but what Mary offers them is all of herself. She's just who she is.
She just cares about her patients, and it shows every time you come in, every single time. So I'll come to her forever.
I got comfortable with her and just never left. I live 20 miles away now and drive out here to see her.
Been coming here for 23 years, and I wouldn't go any other place if I could find Mary and see Mary. I told her when she goes, I'm going to order my casket, because that's it. I'm not going anyplace else.
Well, I don't see Wisconsin. You don't? All right.
Yeah.
Probably look in the wrong direction anyway. You don't see Russia in there? We can hope not.
There's something about Mary. Something special about this nurse practitioner, Mary Fye, who has practiced rural medicine at the Dexter Lakeside Clinic for well over 2 decades.
I think bottom line, if you look back now 25 years, the thing that people like the most is that we're honest. And we're even honest when we don't know what to do with them or whatever they've always said. The thing we like the most is you find out, even if you don't know right then.
But the patients will tell you it's more than just honesty.
I think one of the main things about the clinic here is that Mary and Jane treat their clients more as friends instead of just patients.
The atmosphere is more home-like. There's a warmth to it that either can't be duplicated or very rarely is duplicated in a more traditional clinical setting at a hospital or a larger clinic.
She did not tell me she fell. Now you're in trouble. So now you can say your famous line. And why did you not tell me?
Well, it was really...
No, say your famous line.
Well, because you're closer and meaner than God.
That's right. My all-time favorite. Okay.
What I see sometimes are doctors that are so busy trying to squeeze 40 or 50 patients in a day that they don't have time to chat or get to know the patients. Mary does that. She gets to be friends with the patients, and they love her. They just love her.
It's a very personal office. You know, they call you by your first name. They don't call you by your full name. They ask how your Christmas was, how you've been feeling, or are you looking better, or you look like you're doing better. They're just really caring, and they're the best.
They make sure that the kids are really happy every time that they come, and if we have any troubles with having them here when an appointment is being done for me, the office staff will come in and take care of them, and I won't have to worry about it. It's really friendly. I love it here.
On days when she's busier, she doesn't have time to chit-chat with patients, but she's still who she is, and she's still very personal with them, and she lets her personality come through.
I can talk like a logger. I can talk like an old person. I can talk with difficulty, some teenage kind of talk. I can certainly talk baby talk. I try hard to get at the level of the patient.
You may also notice a couple of the clinic staff that really gets to the patient's level on all fours.
Carly and Luke, they're my favorite employees. They work for Milk Bones.
Well, Luke and Carly are the pet therapists. They happen to be my dogs, and they've added a dimension to the clinic in that people can relate to them. Everybody in the country likes dogs. I've had kids come in that had dog bites, and they said, I'll get a shot, but not until I get to hold Luke, which is pretty bizarre to us, but it's just another steadying force, and People sometimes hold the dogs when they're talking about something sad, and I know that because the dogs will come out with tears on their heads.
We have, for instance, an elderly population here, and there are some people who the only time that they're ever touched is when they come in here. So when she's talking to them, she has her hand on their shoulder.
You sound better than you did before.
I feel better.
You're actually, you're moving the air in the bases, which you weren't doing the last time.
You have to touch people to make them better. That's part of our training, our background. And so I do that. I have to be in their face or up touching them. Otherwise, they're disappointed. People tell me all the time, I see the specialist and they never touch me. What's up with that? I say you're going for their brains, not their touch, except for the surgeon.
Some people just stop by once a week to get a hug and say hi. And we get to do that here because Mary allows it, because she thinks that's important. She thinks it's part of total health. And they literally sometimes just stick their head in the door and say hi and don't even cross the threshold and go back out. They just need a connection. And that started with Mary. That started at the top of the organization and has filtered down. And as we've hired new employees, that's not something that you train, but they see it and they pick up on it and participate in it.
I would say that she just treats them with as much care as she possibly can. And, you know, she basically treats you as family when you come in.
Can I put it on here?
She's really good.
Yes. Hold still. You're a great patient.